Okay, folks, we're going to discuss now the disease concept of alcoholism or the disease concept of addiction. And it leaves us first, and let me start off by asking a question that has been going around for many, many years, and it's a hotly debated topic, and that is whether we want to consider addiction, alcoholism, etc., as a disease. Back about 1960, E.M. Jelinek wrote his treatise on the disease concept, and he certainly outlined phases of addiction that people go through and symptoms, etc., that make up a disease. But we also know that back in 1956, the American Medical Association came forward and said, yes, alcoholism, for instance, was a disease. First off, let's ask the question in terms of definition. How would you define a disease? Well, if we look at the term and the word itself, dis-ease, right, if we split it up, we know that this is a system that basically is out of balance. It's lacking in biology what we would refer to as homeostasis. So by definition, a disease is an illness or sickness that causes an interruption or disorder of bodily functions, systems, or organs. Now, two points here are very important to consider. Number one is that we have what we call, and this is a fancy term which I'll break down very quickly, we have what is called an etiologic agent, right? So this is an agent or a substance that is causing an issue, that's causing a problem. It's a background or root cause of something. Well, we know in this case the etiological agent is either alcohol or X drug, whatever that happens to be. The second part is, and it's really part of the disease concept, is to say that there are signs and symptoms of the disease. So what we identify are red flags, signs, symptoms that something is wrong, that somebody possesses, in fact, this illness. We can use the analogy, and if we want to put this in terms of a medical condition or a medical concept. Let's say you go to a doctor. The doctor basically says, hey, what's going on with you? What's your presenting problem? You tell the doctor, Doc, this is what's going on with me. These are my symptoms, what I'm experiencing. The doctor maybe does a series of tests, runs a series of tests, and from that point forward, the doctor comes up with a diagnosis. But they're also acting initially on the signs or symptoms that you're telling the doctor about. If I met you and I noticed that you had a runny nose and you complained about a sore throat and a cough, etc., I can maybe make an initial diagnosis or a preliminary diagnosis based upon your symptoms to say, hey, you know what, you look and sound like you have a cold, okay? And it wouldn't take a rocket scientist to do that, but again, the focus here is on symptoms or symptomology. We see that with the disease concept of addiction, the disease concept of alcoholism. Now, if we look at alcoholism as a disease, we put it under the specter or the spectrum of a health problem. And we know, in fact, that alcohol and alcoholism is a major factor in growing health care costs in this country today. Some of the statistics and figures are pretty frightening when we look at the fact that, for instance, 50% of all emergency room admissions are alcohol-related. 30% of all hospitalizations are currently alcohol-related. So we know that alcohol and drug use is a major health problem in the country. There's major loss of industry and work due to it that is costing literally billions of dollars in terms of resources and billions of dollars in terms of the economy. Further, if we put it again under the health perspective, we know and we can identify that there's a definite profile of alcohol-related damage to body systems and organs. In fact, if you take a look at alcohol alone as a substance, there pretty much is not a single organ system, body system that is not negatively affected by alcohol. Now again, you may be thinking to yourself, well, I've heard things about alcohol that were perhaps positive. For instance, the old French paradox, which says, well, gee, if you drink wine, it's preventive for heart disease, etc. That's true in small doses, but again, we're talking about alcohol use, somebody developing alcoholism, and it becoming a major issue in their life. And the bottom line is it's going to cause major health problems. In terms of diagnosis, we go back to our idea of a doctor, or our doctor making a medical diagnosis. Well, there's a guide that we have, which you may be familiar with or not familiar with, that's called the DSM. That's the Diagnostic and Statistical Manual. Started out as the first volume or first edition. We're now up to present day, up to the 5th edition, and this is basically the Bible of mental health, if you will. There's a variety of different diagnoses and different axes that are used as part of the diagnoses, and each diagnosis has a criteria that must be met to follow that, to meet that diagnosis. With alcoholism, with drug abuse, or with addiction to those substances, what we find typically, and these are major concepts or major criteria under the DSM-5, we find, number one, a pattern of very compulsive use of the substance. We find a pattern of developing tolerance to the substance, and we find a very characteristic withdrawal episode or withdrawal from that particular substance. And again, withdrawal is indicative of a physical tolerance that's built, but also a literal physical dependency upon that substance. If we take a look at first the pattern of compulsive use, there's a whole set of symptoms alone that is identified within that compulsive use. But let's just take a moment and stop for a moment and just think about and clarify a couple other terms, though. One is compulsive use, compulsive, and the other one is obsession, compulsive or obsession. Compulsive refers to the behavior itself, doing something over and over. Obsessive, or having an obsession, is the thought process regarding it. So if we look at compulsive use, what are the symptoms? Well, we know by record and by dealing with alcohol issues for a long time now that a craving response for a substance is one of the key parts of the symptomology of the compulsive use. So in other words, that person craves the substance, they have a preoccupation for it, they may be having a physical reaction to that substance, and they want that substance. There's the characteristic loss of control of the substance, which basically says, hey, you can't, the old idea of, we all remember the Lay's potato chip commercial, you can't eat just one. This is the individual who has that first beer, who has that first snort of cocaine, who has that first hit off a meth pipe, etc., and they lose control from that point. They don't stop at that point. Next is an inability to abstain from the use. In other words, stop using. We know the great literary giant Mark Twain, and perhaps Mark Twain said it best. Mark Twain said, "I'm great at stopping smoking. I've done it 1,000 times." That's exactly the point, an inability to abstain from the addiction. The person then, from that point, in one of the symptoms of the compulsive use, really is an addiction-centered lifestyle. In other words, there's a prominence of drugs in their life. They see their life through the mirror or color or veil of their addiction. So what's important to them is when they're going to use, what they're going to use, what it's going to feel like. That's what they're tied into. It takes up a lot of their thinking space, right? Normally, if you're sitting there, and maybe you're sitting there listening to this talk on addiction, there's lots of different thoughts that are going through your mind, right? And this is typical on a day-to-day basis. We may be thinking about our job. We may be thinking about school, children, driving. There might be, within a 10-minute period, there may be 100 things that quickly slip through your mind and they're gone. But the bottom line is perhaps no one thing is taking up a lot of your mind space or mental space. Well, somebody who becomes addicted, what starts to happen over time? A lot of their mental space is occupied by things that are related to that alcohol or drug use. Again, the substance itself, what they're going to feel like, where they're going to obtain the drug, are they going to go to a dealer's house, et cetera, et cetera. It becomes a big part of their life. Also, as part of that, and I think we see this too in the terms of the continuum of addiction, there are what we call addictive lifestyle losses. In other words, addiction can be a risky business. And what starts to happen over time as a person gets further and further into their addiction, they start to give up and lose essential things in their life. It could be activities that they used to do that are now supplanted by their drug use. It could be social relationships that they have had that have gone awry. It could be additional risks that they're looking at that include getting arrested, falling into legal complications, their freedom being taken away from them through being incarcerated and so forth. So these are all losses or risks that they're willing to take. And when we look at, going back to the DSM, when we look at the criteria, perhaps one of the most pertinent criteria, and certainly one of the most powerful criteria we see, is the idea of continued use of that substance despite adverse consequences. So in other words, their use, the losses they've experienced, the negative consequences and ramifications of that use, they can tie directly to their drug of choice, be it alcohol or any other drug, yet they continue their association and, more importantly, the relationship with that drug of choice. That, for a lot of folks, is a very clear indication that they're well on the road to addiction.